Connexall was created to solve a key problem facing today's businesses, and that is the management of business events that take place. We find in many of the industries that we deal with, specifically healthcare, manufacturing, retail, that there is an abundance of information that needs to be disseminated to staff and in some cases to customers and clientele in the form of events, things that take place that people need to know about. And generally those events are created in a variety of different business systems provided by a variety of different vendors. Healthcare, for example. If you look at any of the typical healthcare institutions, be it hospitals or long-term care facilities, there are abundance of systems that generate information that the people in those facilities need to see. For example, nurse call, infant abduction, patient monitoring, fire alarm, access control, security. All of these systems generate alarms and events. In some cases, in the case of fire, there's an annunciator panel at the main entrance that beeps and beeps and beeps until somebody happens to walk by and notice it. In the cases of nurse call, for example, there are the lights that go on over a particular patient's door that is requiring attention, and a chime that is beeping somewhere in the facility, but not very sophisticated means of getting the right information to the right caregiver or the right person. But in fact, that's what Connexall does. Connexall is that unifying force. Connexall is that central application that connects to all of these disparate systems that are generating event activity using their own proprietary communication protocols, typically, and gathers that information into a central repository, into a central database, and then provides notification to a variety of different output technologies as well. Because there are no open standards necessarily when it comes to communicating with pagers and wireless telephony and email and scrolling marquees and a variety of other different technologies that can be used to let somebody know that something has happened. Connexall has actually been extremely successful in the healthcare space for a couple of reasons. One is just the requirement in healthcare to really provide an effective, centralized management interface for notification. As mentioned earlier, there are so many systems in healthcare that generate event information that people need to know about. And unfortunately, there isn't a standardized approach to bring all of these systems together and manage them as a whole, as opposed to manage them currently as individual little silos, which is very labor intensive, not very efficient when it comes to extracting reporting information and knowing what is the interaction between these different systems. And just expensive, given proprietary and standalone solutions that are put in place for each of the different systems that company happens to have. So Connexall has been successful because that is an environment where getting the right information to the right person in a very timely fashion, real time ostensibly, is crucial. Another interesting vertical we found actually within healthcare is to apply Connexall in the OR suite, in the operating room. The OR is a very, very busy place, as one can well imagine. What we've been able to provide is essentially using Connexall, once again, as a means to trigger the event, the requirement for a particular quick section or some surgical supplies or a warming blanket, and to allow the circulating nurse within the OR to trigger that event by simply clicking on an icon on the screen, a representative icon. Now that information now is immediately communicated to the people that are assigned to assist that particular OR, and they will receive the notification, again typically on a wireless telephony device, where they can see the information, they know where the call is coming from, they know what is required of them immediately, that I need to go get a particular section from the lab, for example, and they can go and do that immediately without going back to the OR and saying, what do you need? Typically there are far fewer nurses per patient than there were in the past. They are deployed, they are in the field, if you will, in the rooms, dealing with these issues, more than just sitting idly waiting for calls to come into a central desk. And so there really was a disconnect between what traditional nurse call was capable of doing and what it was required to do. And Connexall has really filled that void in the sense that we integrate to the nurse call system, typically provided by a third party of a variety of different vendors that work in that space. We tie into that system and gather that raw event. We know that the patient in room 100 has pressed his call bell. At that point, we then take that event, bring it into the notification package that is Connexall, and dispatch it to the appropriate caregiver for that particular patient. Typically, a caregiver that has assigned themselves to that patient's room coming on shift. Historical reporting is also very important too, to determine the nature of the calls that are coming from the nurse call system and when. And that can help with things as diverse as staffing or just looking and targeting areas that need more attention within the facility as far as delivering good quality customer care. Using Connexall, using the core notification engine that we've discussed in the past, we have essentially added a layer to that that allows for Connexall to in fact generate the events that we're talking about. We call them virtual call points. A call point is just another name for, typically a nurse call, the button that gets pressed, for example. So here we have created a layer to the application that allows us to generate virtual call points simply by having a user double-click a representative icon on their Windows desktop. And how we've applied that is we've created a variety of icons that represent porter required and different states that can be used when triggered to notify the porter staff that their services are requested in this particular part of the facility. So that the person who needs to contact the porter to have them come in and bring a particular patient can double-click on the screen. That notification goes to the wireless device that the porter is carrying. And just like before with nurse call, now they know where that event is occurring, what the requirements are, when they are required, and they can acknowledge and respond as if being dispatched, if you will, using that wireless device. Generally, there are a number of parties within a hospital or a healthcare facility that are involved with the implementation of Connexall. Starting, of course, with the nursing staff or the staff that will be using the product day in and day out. We work really extensively with them to understand the specific requirements that they have for improving communication in their respective areas of the facility. Given the fact also that Connexall is an IT-based product, an IP-based product indeed, we also need to interact with the IT department within that facility. And certainly, of course, there are the business people that are involved as well that are looking really for not a solution for the sake of a solution, but a technology that is cost-effective and will deliver true value to the clients and to the staff of the facility. Training and support is a very, very important part of what we do at GlobeStar. Connexall is a very capable product. We've designed it to be very, very intuitive and straightforward as far as installation and as far as end-user interaction and use. But still, given the diversity of systems, the diversity of environments into which Connexall is applied, training is helpful. We have developed an extensive training program at GlobeStar to allow for up to a week at a time for technicians to come in and get comprehensive, hands-on technical training. Given the business critical nature that many Connexall applications are applied to, support is very, very important. 24-hour, 365-day support. So we ensure that we have that to offer to our clientele. The product has existed now for nearly half a decade, but over that period of time, it has been constantly evolved and expanded and enhanced based upon customer feedback, the dealer feedback that we have from the people that are out representing the product and selling it to the end user. And that is an extremely important part of our development process, is to ensure that the product that we're providing is sufficient, if not more than sufficient, to satisfy the needs of the customers and the people that are out positioning that product. So in summary, if we look really, what is Connexall? It's event notification management. It's taking events that occur in one part of a facility and letting people somewhere else know that they've taken place, but letting the right people know using the right technology and in a timely fashion. So taking that general basic premise and then wrapping it into various different types of applications, whether it be in healthcare or manufacturing or retail, really, that's what Connexall is all about.